cool.
All right, welcome to the Convergence HQIC Patient Family Engagement for Equity Think Tank for this month of June. I can't believe it's June already. I appreciate all of you taking a few minutes to join us for this quick session today. Today we're going to talk about the opportunity to share quality improvement projects and initiatives that your hospital has completed, sharing internally with your hospital or broadly with the whole community of Convergence HQIC hospitals nationally as well through a storyboard. Excuse me. We will also be sharing about the opening of the Patient Family Engagement for Equity final assessment. So we'll talk a little bit more about that as well. As we get started, if you wouldn't mind taking a moment to please introduce yourself. I think we have a small enough group we can kind of go around the horn here. Would just love to know who you are, what hospital you're from, and your role. And then welcome you to share anything that you're excited to celebrate coming up. I'll start. I'm Lindsay Galley. I'm the Vice President of Programs at PFCC Partners. We've been collaborating with Convergence to bring all things patient family engagement for equity to the work that we're doing here together. I'm located in Sacramento, California, and one thing that I'm celebrating today is an upcoming vacation. I'm headed to Kauai with my family in almost a week, a little over a week. So I'm really looking forward to some time at the beach. How about Gloria? Would you like to take a minute to introduce yourself? Oh, and Gloria, maybe your audio isn't working at this time. If you want to introduce yourself in the chat, that is great too. How about Deborah? Deborah Nelson? Oh, checking the chat. Oh, thanks, Bev, for introducing yourself in the chat. Bev is an RN from Clay County Hospital in Alabama. Love working in my garden, sewing, and reading. Awesome. Thanks for sharing that, Bev. How about Leslie Johnson?
Can you hear me?
Yes, I can. Hi.
Oh, yay. Hi. I'm Leslie Johnson. I am in Franklin Hospital in Benton, Illinois. I am from Carlisle, Illinois, so I drive an hour to get here.
Oh,
So I
wow.
live right next to the lake. I am the Director of Quality and Risk Management Specialist and the Patient Safety Officer. And I am celebrating getting my 110-year-old porch refinished in the next couple weekends for my husband. So
Woohoo.
I'm very excited about that. A very old
Awesome.
house. So I'm excited for the porch to look good.
That'll be perfect for summer. Yeah.
Yes.
Sitting out there. Awesome. That sounds great. Thanks, Leslie. You wear a lot of hats at your hospital, it sounds like.
Absolutely.
Uh,
And I'm sure
awesome.
there's room for more.
Oh, right, right. Great, thank you. All right, Gloria or Deborah, if you want to come off mute and introduce yourself, or please feel free to introduce yourself in the chat. I also see Mari has just joined. So Mari, we're just kind of doing some introductions, just who you are, the hospital or organization you're from, your role, and just anything that you're excited about, like a vacation coming up or a new deck.
Hi, everybody. I'm Mari with Patient Experience here at Broward Health Imperial Point. I'm just excited to really be here to learn more about the patient family engagement for equity.
Great.
Yeah.
Well, we're excited you're here and excited you're excited.
Always excited to learn new stuff and more.
Absolutely. Great. Well, you're in the right place.
Yeah, thank you guys for hosting this.
Of course. Yeah. Of course. Of course. Yeah, and if you haven't introduced yourself yet, please do so in the chat. These 30 minutes really kind of fly by, so I'm just going to jump into our discussion for today. So just a little level setting. These think tanks are an opportunity for all of us who are excited or interested about patient-family engagement for equity to come and learn together. Whether you're sharing or listening or learning, we are open to have you and really open to anyone who is interested in engaging patient-family partners or is actively engaging patient-family partners in your work and just a desire to share and learn. These happen on the second Wednesday of each month, same time, same place. So our next meeting will be on July 10th. And these will go through the end of the Convergence HQIC through August or September. So we still have a few more left, which I'm really excited about. These have been great to get to know individuals within the HQIC and your hospitals and the work that you're doing. And I see Libby is on. Sorry, Libby, I didn't see you there. Did you want to come off mute and introduce yourself?
I was late, so you're good.
Oh,
No
good.
worries. Yes. Hi, everybody. I'm Libby Hoy, the founder and CEO of PFCC Partners, and as always, delighted. But Mari, your chipper excitement to be here just really cheered me up today. So thank you.
Yeah.
Oh, thanks. Pleasure to be here.
Awesome.
And Lindsay, I was just
Yeah.
typing into the chat, but wondering, as you mentioned the last few think tanks coming up, if there were any topics people wanted to enter into the chat that you feel like that are pressing topics we really need to cover before we sort of finish up.
Yeah, that would be really helpful. Great question, Libby. So yeah, if there is anything that you have some big questions about related to patient-family engagement for equity, please put them in the chat and we'd be happy to address them on our next few think tanks. Great idea. And while you're thinking about that, we're going to jump in. So this is all about celebrating the work that your hospitals have done, whether through the last 5 years with HQIC or just anything else that your hospital is just really excited about and excited to share and celebrate, whether it's internally with your own hospital staff or externally to share with others, other hospitals, you know, to spread best practice and share things that have worked locally at your hospital that could be applied at other hospitals as well. And of course, this being the Patient Family Engagement for Equity think tank, we're putting a special focus on, you know, what that looks like with patient-family partnership and how patients and family caregivers are engaged in quality improvement. So I have a quick poll that I would like to bring up just to kind of gauge where we're at. All right, so there's a poll and there should be 2 questions there. The first is, does your hospital have a quality improvement project that it is excited to celebrate? So we have yes, can't wait to share, not too sure, but we'll look into it, and not at this time. And then the second question there is, did that project engage patients and family caregivers in some way, one way or another? I'll leave that open. For another 20 seconds or so. All right, we've got about half of you. I know we're a smaller group, but that's okay. All right, I'm going to close the poll. If you didn't get a chance to complete it, you can also add to the chat. So it looks like not at this time overall for both of the questions, and that's okay. You are in the right place, and maybe we'll spark some new ideas. Sorry, I wasn't sharing the results there. And we have one that will look into any quality improvement projects that are currently taking place or that have taken place over the past couple of years that may be of interest to other hospitals to celebrate. We think it's so important to celebrate, small and big wins within your hospitals. Really to just, kind of spread motivation for whatever that topic is that you're working on, and whether it's within quality improvement or the strides you're making to engage patient family partners in the work that you're doing. So definitely keep that celebrating spirit alive. And one of the ways to do that is to complete a storyboard or put together the story of a quality improvement project that your hospital has completed, to really kind of give the narrative of all of the things that your hospital teams have done to create and sustain improvement within your hospitals. So this is an example of, it's a template actually of the HQIC Hospital Quality Improvement Storyboard. So you can see just capturing information about any specific quality improvement project. So, who your hospital is, the aim statement, why it's important to your hospital, who was on the team, and then the actual improvement project. So who is your target population and how did you identify that target population? What was the engagement strategy that you tested? And you can see right there, patient family engagement is one of them, because patient family engagement is an active strategy, and when applied to any quality initiatives, can get you the outcomes that you're looking for, because you're engaging that unique perspective of the patients and family caregivers. So of course, that's one of the engagement strategies that you can test. And then what were the change ideas tested? Did you utilize any HQIC tools or resources? There is so much available to the HQIC hospitals, including Libby and myself as patient family engagement for equity coaches, and working with hospitals to, develop listening sessions and full patient family advisory councils. Just meeting your hospitals where you're at and providing the resources you need to help move you forward. So this is the quality improvement storyboard. This template is available to all of you if you have a quality improvement project that you would like to highlight and share. But there are multiple different templates available. So the one I wanted to pull in today was the Patient Family Engagement for Equity Milestone Moment template. And this one has been adapted from a milestone moment tool that PFCC Partners has developed to really capture those moments in a project or in a hospital's journey where patient and family partner insight has really been utilized within an improvement project or the work that your hospital is doing. So this milestone moments template, also available to you, really focuses more on what did patient family engagement for equity look like within that project. So some of the same information, under the hospital information, but then when we get to the actual project, just looking more closely at how did the patient family partners impact the project? What did that look like? Did you conduct surveys about your discharge process to support readmissions or lowering readmissions? Did you have a listening sessions with patients who had experience with sepsis to learn more about, what are those opportunities for improvement within our sepsis protocols? So in what ways did patient family partners impact the project? And then of course, tools and resources, measurement, results and insights. So what worked, what didn't work, and why? Sustainability, and then finally, pearls of wisdom to share. And I love this section because it always highlights just some of those, really simple things that you may not think of when you get into an improvement project and when you partner with patient family partners. But once you have that hands-on experience, there's definitely pearls of wisdom and things to highlight that can support other hospitals who are looking to take those next steps forward. So these were just a few templates that you can use, and you can choose which templates to use based on what your hospital quality improvement project is or priority. And we'll share all of these in follow-up as well. And encourage you to, connect with others within your hospital. In some of our recent work, we've seen some siloed activities happening. So really kind of dig deep and ask around and figure out where improvement is happening and what that looks like in order to share it more broadly. I think one of the Convergence staples is that, we can go further together. So how can we continue to learn from one another? And I wanted to share an example of, so this is more specifically a hospital quality improvement storyboard. So this quality improvement project was focused on sepsis. So you can see the area of focus over on the left. Why is this project or topic important? What engagement strategy did you try? So this team had engaged the C-suite first, so getting that leadership engagement, medical staff, 3 attending physicians, and bedside nursing staff. So this might be a silly question, but I'm curious if you see opportunities to potentially engage others in a project focused on sepsis. Who else might we want to engage?
Surgery staff, infection control,
Infection control?
yeah.
Who else? There was one more you said.
OR, surgery.
Surgery, okay, surgery and OR. Yeah, we can see up here they've defined their target population too for this project as all patients in the emergency room and on the medical surge unit. So thinking about that too, any others that they might want to engage? Infection control is a great one, Leslie, thanks.
Patients and families.
Woo! Yay! Yes, Lori. Patients and families who, have experience in the emergency room or on the medical surge unit, or, patients who have real life experience with sepsis and have been diagnosed and have gone through that process. That is a really good opportunity, because then moving forward, you can see that the change ideas that they tested the change ideas that they tested. So first they used a discovery tool. So the discovery tools are incredible tools to really capture information about, the current state of any given quality focus for your hospital. So this one being sepsis, and allows you to collect information about what this looks like at our hospital right now. That tool has a patient family engagement touch within it. It's one that we worked on closely with those who developed it. So a great way to start there. And then you can see they developed, implemented, and utilized a sepsis patient tracking tool for the ED staff to track all patients transferred to a higher level of care. So with developing new tools and processes, those are great areas to bring in the patient and family perspective into, how that tool is developed. What type of tracking information were they gathering? How is it being implemented and utilized? And really kind of running these ideas through, patients and family caregivers who will be, kind of the quote unquote end users of this newly developed and implemented process. So by having patients and families as partners throughout that process, you can ensure that the processes that are being implemented will be beneficial to those patients and their family caregivers as well at the forefront, instead of, going through this whole process, realizing that, one thing or the other doesn't work because, the patients were impacted in a different way than what you expected. Have that unique perspective at the forefront of some of the change ideas that your hospital is implementing. And again, it can be as simple as having a survey in your emergency room that people can fill out while they're waiting. I know a lot of patients do a lot of waiting in the emergency room. So is there just a small, quick survey that you can do about, newly implemented processes? Or can you host a town hall or a quick hour listening session to talk about new processes that are being implemented for patients? So just some smaller tests of change within this more bigger test of change to really engage that patient and family perspective in quality improvement work. You can see this team used a ton of HQIC tools and resources, including coaching, one-on-one conversations with quality improvement specialists. Again, Libby and I are always available to chat one-on-one if you're thinking about doing a small test of change around patient-family engagement. Happy to connect with you and talk you through what that can look like at your hospital based on your improvement activities. But participating in learning events, there are so many change packages available, the discovery tools that we talked about, and then the listserv, which is another incredible resource, probably how all of you found out about today's think tank. So that's not just for us to get information and opportunities out to you, that's also for you to ask questions of the broader community of HQIC hospitals. There have been so many incredible conversations and resource sharing that have gone on there. So a really valued resource as well. All right. So what's in it for you? And so I pulled some of this from the messaging that went out about the storyboards. But like I said from the beginning, this is an opportunity to share your work within your hospital, whether it's at quality committees, department meetings, or through newsletters, other types of communication. It's just that opportunity to celebrate those small wins internally. So you can take one of those storyboards, complete it, and then use it as your own to share within your hospital. If you go to conferences, utilizing it to share at conferences. But of course, we would like to see what your hospital is doing as well. So each storyboard will be part of the Convergence HQIC webpage, of course, with your permission, and will really serve as a source of inspiration for other hospitals that are working on similar topics or similar quality improvement projects. As you can see, each submission will also receive a certificate of recognition for your team's work as we wrap up the HQIC. So really just an exciting opportunity to celebrate all the work that you have done. And, I don't think we take too much time to sit back and look at the last 5 years and really gather all of the incredible strides that your hospitals have taken to address quality improvement, address patient-family engagement and equity. So really important to take the time. I know that time is a really valued resource to all of you as well. But it's so also valuable to take that few minutes to think back and also celebrate with your hospital the amazing work that you're doing. So how might you go about submitting a storyboard or work or project that you're really excited about? So first is just to create a storyboard. So in follow-up, I'll send you the 3 templates that are available to choose from. And really just putting in all of the information about your improvement project, because you have seen this opportunity and maybe others who are more closely involved in quality improvement projects, connecting with them and work together to complete it. There's also a short survey involved just to, get your approval for sharing more broadly. I know we're a little late on time, but looking for those storyboards by the end of this week, I believe, June 15th. And then Kim is an incredible resource, and you can reach out to her with any questions. And then, of course, you can reach out to myself. I'll have my email at the end of this slide as well. But really looking forward to see, we've seen a handful of really great storyboards and, the results that hospitals are getting from implementing these really valuable improvement projects, and are really excited to see some that have actively engaged patient family partners within their processes as well. All right. So in the last couple minutes, wanted to quickly talk about the final round of the patient family engagement for equity self-assessment. So we have done these a number of times over the past 4 or 5 years. This is just, it's a self-assessment and it's also an opportunity for your hospital to walk through 5 metrics related to patient family engagement. So in the past, we've also collected metrics around the collection and analyzing race, ethnicity, and language data as well. But this one, we're solely focusing on the patient family engagement metrics, which is engagement in the admissions process, in bedside rounding, and in discharge planning. And then the last 2 are more related to patient family engagement and hospital operations. So does your hospital engage patient family partners in improvement projects, or do you have them on committees, or do you have an active advisory council? And then the final one is, does your hospital have patient family representation on your hospital's board? This is an optional activity, but a good activity for your hospitals, because there's also lots of resources associated with each one of these metrics. As you're completing the self-assessment, we have tools to help you think through how to get from one stage to another. So the self-assessment is set up as oh my gosh, Libby, help me out. Not a Likert scale, but
It's set up in a maturity model.
Maturity model, thank you.
So that you can track your progress towards meeting the metric. Yeah.
Exactly, yeah. So there are, tips and activities that can help you move through that maturity model and just help your hospital grow when it comes to patient family engagement, whether it's at the bedside through those first 3 activities, or in the boardroom and in the hospital operations.
And just
oh yeah,
a slight correction there, Lindsay, on the 4th and 5th metrics. This time around, they 4th was if you have a point person leading your PFE activities, and your 5th was if you had a patient family advisory program. So not necessarily even a council per se, but just if you had patient family advisory program, but the board metric was removed.
Great. I am living in the past.
Yeah, no, sorry. All good. All good. Let me grab that link.
That's funny. Yeah, that, of course. Thank you for that correction, Libby. So if your hospital is interested in moving through the self-assessment and this activity, again, it's optional. It's open through June 1st through 30th, but it not only gives us information about your hospitals, but also gives you a good kind of standing of where your hospital is at and tips and ideas on how to move forward. So we will send this out and follow up as well, and you have till the 30th to complete it. We will be using this final round of assessments to develop some more programming and support for your hospitals through July and August. So what you share here will really help shape the information, the continued support and information that we will be rolling out towards the end of summer. All right. And with that, we are right at the end of our 30 minutes together. Again, it did fly by. There's my email if you have any questions. I will send a follow-up with the storyboards that we talked about and the link to the PFEE assessment if you'd like to complete that. But are there any questions at this time? All right. Well, please reach out if you think of any questions, and I will be following up. Appreciate you spending 30 minutes with us today out of your very busy schedules. I'm so appreciative of the time that we had together today. And yeah, I hope you have a great rest of your summer and month. We'll see you back in July.
Thanks, Lindsay. Thanks, everybody.
Thanks. Bye.